Good afternoon. I'm delighted to welcome so many people today to our webinar on becoming an anti-racist organization. We're thrilled to have leaders from Lutheran social ministry organizations here today to share candidly their journeys, their challenges, and the next steps forward. Now, this webinar is after we've had several set of webinars from outside experts, Miriam Bigland and Corey Flournoy, but we thought it was really important to hear candid conversations from people with inside our network and to take advantage of our close, trusted network and the environment here today. So what I'd like to do first is to share a few housekeeping details before we get to the program. Please first, when we interact, and we will be very interactive today, please announce yourself and the organization that you're from. Please put your name and organization in the chat box. We are using the chat box actively today, so please feel free to type any questions into that. We will be taking questions that way as well. We chose Zoom so that we could be interactive. So we'd love to see everybody's photos today. So please, if you can, stay on camera. And then finally, if you could have any technical issues or need assistance, please contact Caitlin Gudmundsson or Alicia Frericks in the chat box. So what I'd like to do next is to introduce our moderator today, Drew Gensler. Drew will introduce our panelist, but Drew has been the president and CEO of Lutheran Metropolitan Ministry since 2013. Drew has also remained as a chaplain in the U.S. Navy Reserves. Drew, turning it over to you.
Hi, Charlotte. Thank you so much. Hi, everyone. Can you hear me all right? I think so. Somebody give me a thumbs up. Thanks, Caitlin. Greetings from Lutheran Metropolitan Ministry in Cleveland. I was trying to get our slogan behind me here to appear in the sort of right way on the camera, but if any of you are Hebrew scholars out there and can read from left to right, then from right to left, I suppose you'll understand that this is LMM in Cleveland, Ohio. I'm delighted to be with you all today. We have a strange two-pronged purpose here at LMM in terms of our anti-racism work. We're founded around race reconciliation efforts in 1969, and yet we find ourselves newcomers and in some ways swamped by the public discussion and debate and demonstrations. And so I'm every bit a learner here today as much as some of you feel you might be. And I am always just blown away by the expertise that is in this LSA network when we gather in any number of formats. So it's good to see as your names pop up on the bottom there. It's great to see a lot of familiar names. Great to see some others who might be joining this conversation. I am delighted also with this panel today and with this opportunity, this privilege, I might add, to moderate what I hope will be, what I know will be a rich discussion for the next hour or so. So I wanted to start us off, as some of you are still signing in, I'd like to start us off with a question for all of us in general, and you can share your responses in chat, and we're going to pull those responses together. But just to get a sense of maybe where you are in a very personal level with the general idea of anti-racism work or the idea of racial justice. I know there are a lot of terms of art that float around. So I wanted to ask you all if you've had, in your experience, and I know you might be joining this call as an executive or as a program director, a board member, a staff person at any one of our LSA member organizations. How many of you have had someone approach you to personally express to you a sense of loss, maybe over this summer, or maybe even a sense of fear, or maybe even a sense of anger, but nonetheless a very personal response about the need for organizational change in your role? So how many people have had an employee or a colleague at work in your organization approach you about that need from a very personal place in their lives? And we'll get back to some results on that, but I really appreciate your responses there. Well, it's a delight to, even in the midst of this serious time and very trying times for a lot of us, it really, I have a sense of hope every time I listen to my colleagues on this panel, and we've talked a couple of times in preparation for today. So it's a real privilege to moderate today. I'd like to introduce 4 of our colleagues from across the country at different Lutheran Services in America member organizations. Some are no strangers to you in this work. First, Damon Kelly, the President and CEO of Lutheran Social Services in New York, located in the heart of New York City. Damon is committed to advocating for and improving the lives of the formerly incarcerated, people living with mental illness, developmental and intellectual disabilities, and people experiencing homelessness. Welcome, Damon, to the conversation today. We also have with us Ms. Beverly Jones, who is the VP and the Chief Operating Officer, and Mr. Mike Bertrand, who's the President and CEO, both of Lutheran Child and Family Services in Illinois. Both Mike and Beverly are committed to contributing to better outcomes for children and families in their state, and have worked tirelessly to address racial disparities in their child welfare system. And I might add, after listening to them, addressing the sense of racism also at LCFS, and we're going to hear a lot more from them as well. Welcome to Beverly and to Mike. Thank you. And finally, today we have Dr. Paolo Pina, who is the Pediatric Medical Director and Assistant Clinical Professor at NYU Langone in Brooklyn, New York. Dr. Pina has been on the front lines of our, oh, by the way, COVID-19 pandemic, and is now working to understand how NYU Langone can better serve communities of color in Brooklyn who are disproportionately impacted by health disparities in the pandemic. So welcome to you all. We talked about some questions that might best get to the heart of this, and I'd like to start by asking Damon, and then some of you, please chime in. We're going to get to the organizational change, but can you talk a little bit, Damon? Can you walk us through just why is the work of racial justice important? What do you say to your staff and your board about why this work is important? There's going to be a cost to this work organizationally. So maybe start a little bit broader. Why is it important to take your organization on this journey for racial justice and to address systemic racism?
I think one of the reasons why we want to address this issue of systemic racism is because as many of us fight poverty, we're really fighting poverty that has come about because of the systemic and historic racism in this country. And in order to understand the needs of those who are underserved, we really need to understand how they got to that place. We need to understand the laws that have been in place that have limited opportunities for people of color. We need to understand, as staff working with these populations, the trauma that they have faced over the course of their lives as a result of racism, and the impact that racism has had on their lives. And so in order to be able to address that from a trauma-based perspective, we really need to understand what has caused that trauma in their lives that have placed them in that condition. And that's why it's so important to address issues of racial justice, and not because George Floyd was killed, or Aubrey was killed, or Breonna Taylor was killed. This is something that we all should be examining and should have been examining for quite a while.
Those verb tenses you end on there are very important, Damon. I appreciate that. The should have, and how we try to look for a more durable and sustainable response that is maybe acknowledging and respecting these traumatic events, these deadly events, but nonetheless has something more systemic to say and address. I think that's really, thank you, really important. Beverly or Mike, what do you say to your teams and your staff about? I mean, you're a certain way on this journey with your organization. We're going to get to some of the details of that in a moment, but big picture, what do you say to your staff and your board about why this work is important?
Go ahead, Beverly. I'll go after you.
I think
I come from a personal place as well as a professional place around this. In that, as a social worker, one of the values is that everybody has an opportunity, same opportunities to thrive and prosper as they see fit. And you see all around you that that's just not true. And to build on what Damon said about blaming people for being poor or that poverty is the driver, keeps missing, I think, one of the fundamental dynamics going on in our society, and that's systemic racism. And we can continue to go colorblind and say color doesn't matter, and we will continue to have the disparity in outcomes. And we can continue to blame people, or we can go back to our roots and our values based on our faith and training that it's not equal for everybody. There is not equity. And we have a responsibility to address it and address it head on.
I would just add really quickly to that, since you get a 2-for-1 with Beverly and I, that at the core of LCFS of Illinois is to ensuring that children and families are enabled to nurture their children to grow up to achieve their God-given potential. So not recognizing that families of color and children of color are face a very different reality and will not enable us to achieve that end and not able to achieve that mission. So to me, it's also very easily to tie to who we are, to say we firmly believe that all children need to be nurtured in a way to achieve their God-given potential, and to not recognize the systemic racism that affects families of color working on raising their children makes us ineffective.
Thanks. Paolo, you're in an important leadership position of a much larger health system, and you're obviously in a very eclectic place and setting in Brooklyn. What's appropriate to say? What can you say about the decision making at NYU Langone or even the broader system about why this is important?
Yeah, so I think what it's been highlighted clearly this year that this is a matter of life and death in terms of racism and what the inequalities that we're seeing, especially with the COVID and who was dying. That was really jarring for us when we started seeing some of the data back in April. And a lot of us were really upset. And that's how everything got spurred, we got spurred into action. But the fact that racism and what we were seeing with the response to COVID and how certain communities weren't getting as much as other communities, and how that contributed to the issue and to the deaths. So we, in our field, we have a note, first do no harm. And, but that hasn't been happening on a consistent basis, especially with communities of color.
Thanks, Paolo. And let's check in quickly with Caitlin and our LSA team. What kinds of responses do we have in that first question? People are resonating with this emotionally?
Yeah. Overwhelmingly, people said that they had experienced that, and many times, and there was an overwhelming sense that yes, people had folks come to them at their organizations to talk about this.
Thank you. We're encouraging a lot of interaction today, and I want to just I saw one pop up and from I think it's Dottie Garrity I'm sorry, Dottie, I didn't catch your organization, but she brought up the very important topic of the executive order that's floating around anti-racism training in federal departments. I think you're referring to, Dottie. I didn't catch the whole question. And originally beginning with the scope of within the federal departments, but now we're here having signals. Many of you have probably seen an independent sector notice, or maybe other organizations' notices about federal grantees as well. So I would like to come back to that, and Dottie, please keep us honest if we don't get back to that toward the end of the call. make sure we bring that up specifically, and maybe we can have some mutual learning and maybe even hear from our LSA team about that call. Thank you. So let's get a little more specific about the organizations. I recognize how serious these issues are and how fraught they are, and how we all bring our backgrounds and our stories to this. Some of us, of course, much more viscerally than others. But I've got to tell you all, just in preparing for this, there's some real hope there, and there's some achievable progress that we can hear about here from these organizations. And so, wanted to start with Beverly and Mike, LCFS Illinois. What does this journey look like for your organization? And what's kind of, maybe we can name a challenge for you personally or professionally in, I would say launching, but in sort of gathering steam for this kind of process for your organization. How has that looked to date, and how do you gather momentum around it?
Sure, I'll start and leave plenty of time for Beverly. I like, as you said, you phrased it correctly, it's a journey. LCFS really started taking a serious look at what it would mean to become anti-racist organization about 3.5 years ago. And I say we're probably about on the 10-yard line. We have a very, very long way to go. And so for us, it was just making a conscientious decision that we were going to start taking issues of race on, trying to make a comfortable place within our organization to so people can have those conversations to say, is there something, is systemic racism coming into play? We also partnered with a national anti-racism organization and made the decision to require anybody, a supervisor above within our organization, to attend a 2.5-day anti-racism training. We've gotten a little bit of flack on that, but for me, it was real important to send the message that if you are a leader at LCFS, you're going to be in fight against racism. So I'm going to real quickly answer the second part of your question. For me, you said what's been sort of the personal aspect of it, was really coming to that place of being a 30-plus career child welfare professional, and really getting to the place that realizes I've made a nice little career with a system that is exploitive of families of color. And what do I want to do about that?
Thanks, Mike. Beverly, I know you LSTFS, with your leadership in program and data, have actually made some progress on placements, and you did a staff survey as well that had some real metrics associated. And I don't want to be too data driven, I know, about what is again, obviously a very charged issue, but you had a really nice way, I remember hearing of combining those two things. This is a prescient, broader issue, but you were working on it programmatically as well at LCFS. And I wonder if you could walk us through that journey for the organization.
I think once we really got focused on becoming an anti-racist organization, there are things that we put in place organizationally. But the question is, okay, we've done those things. What difference has it made in terms of outcomes? So in 2018, we set a goal for ourselves to decrease the length of time in care for children and youth who we serve in foster care, and that we would increase the number of permanencies, or what I call forever families, for children of color. And we were very modest because we weren't sure about what we were going to be able to do. We said we would decrease the length of time by 5%, and we would increase the number of children who had forever families by 5%. As of June of this year, we went well beyond that, to almost 40% on both of those measures. And I think what's also important is that the vast majority of the children who left care to a forever family went to their birth families, either the paternal side or the maternal side. I think about 65% were able to go home with family. And we did do a staff survey asking them what did they think were the drivers. And two things stood out. One is data helped because people were not aware, and we did it by office as well as statewide, where we had places, teams where no children of color were leaving foster care to a forever family. And staff weren't aware of that. So data helps in that way in painting the picture. But more importantly, they talk about how you work with parents in particular in a very different way. Engagement has gotten much more important and critical in terms of how we do that. We're a far better listener than telling people what they need to do. And parents have joined us on this journey in a very different way to get us where we are. The work continues. And the more you do, the more questions or issues for you. So the work is continuous. So we celebrate our results thus far, but we're still focused on we can still do better. We must do better.
Can you talk, Beverly, just a quick follow-up about the racial disparities you identified in terms of diagnosis of young Black men and young white men?
Clearly, we have a specialized program that works with what we call duly involved youth who are involved in child welfare, but also the justice system. Our African-American young people are going to jail. They're being found guilty. They're being removed from their parents' care, put in foster care, put in detention, and sometimes adult jail. And as opposed to white children, and the staff will tell you, they get to go home, sometimes under probation order, but many times not. So we took that head on, and we've been doing that work for about 15 years, trying to make a difference with that population. And it's located in Cook County, Chicago, and you hear all the things said about the violence in the city, in particular, painting a picture around our African-American youth who are male. You can make a difference. You can make a difference, but you have to really be focused, willing to learn from the people you want to serve, and that you don't have all the answers, but you can do it, is important. It's frustrating at times, it's exhaustive at times, but when you have an opportunity to step back and say, is it all worth it? The answer is a resounding yes. It's worth it.
I just so appreciate that as a colleague that first it's hard work and data driven, but you also bring this real sense of hope to the work, and that there is appreciable progress to be made and pointed to, and I think that's through our program, which is wonderful. Thank you. Damon, how about at LSS New York? Where do you feel they are on the journey as their chief executive, and what would you like to see on this journey for LSS New York?
Sure, thank you, Drew. So in a way, we are kind of different. We're one of the few large-size organizations in the city of New York where the executive staff are people of color. All of our executive staff are people of color, and probably 85% of our management staff are individuals of color. So we have been looking at this from a different perspective. And part of that perspective is the employees are predominantly people of color, but our board members are not. And so we have spent a lot of time working with our board on educating them about some of the racial justice issues that the organization deals with. Like Beverly said, the the disparate treatment of children in foster care, who gets placed in foster care. As Dr. Pina mentioned, the health outcomes that have been a result of COVID, the COVID pandemic, and some of the other issues that we see in the city of New York. Again, part of my work with staff, even though they are people of color, helping them to understand the trauma that our program participants have faced and the privileged status that they enjoy as staff. Even though they are people of color, they enjoy a privileged status because they have a job, they're still getting paid. 98% of them are able to manage their finances in a reasonable way. So sometimes they look at how they work with our client base from a privileged status. And so what our work is really focused on, yes, you are privileged, but understand that your privilege is a result of oppression and disparate treatment, and that you have to approach the individuals that you serve from that traumatic background, understanding, again, as I said before, the impact of racism and systemic and historical racism in this country, and what has led to different treatments, even amongst people of color. And I'll use myself as an example. I'm an attorney and a PhD. I enjoy a very privileged status because of my education. I understand that the way I communicate with others, the way I interact with others, cannot be based on that privilege, but what are the needs that the people have, and what has historic racism, what role has that played in their lives? And that's a very challenging position to be in, quite honestly.
Yeah, thanks. I appreciate that, the personal profile there too, Damon. I know that we have to approach this, wherever you are in your organizations out there, we approach this from our backgrounds as well.
Right.
It's inescapable for some of us. Some of us have the privilege of wrestling, if I might put it that way, with our own privilege, and even having others tell us that we need to recognize that privilege and work with it. And I think being honest and having honest conversation is something that our society is just longing for here. We're, past the kind of slogans and the constant news feeds that we all receive. What are the real and honest and brokered conversations we need to have for organizational change? I appreciate you putting so much of that into it. And Paolo, Dr. Pina, how about for NYU to Langone, maybe you can share that you actually, I think the system came out and said, we've been part of the problem, and we want to do a lot of listening and come to some conclusions and some program change. I wonder if you would walk us through where you feel the system is itself and like in that process.
Yeah. So in medicine as in general, we've been dealing with health disparities for a long time, but unfortunately, I think historically we've taken the approach that it's due to individuals and individuals' behavior instead of looking at systems. And I think what the COVID and the early bad outcomes sort of made us woke us up and just to realize, wait, well, what's going on here? Is it really just individual behaviors, or is there something wrong with our system? And so what we decided to do early on is examine our system and look at our internal data, which we hadn't done before in terms of our quality measure. We decided to look at all of these measures by race. And what we found even though we are an organization here in Brooklyn that takes care of mostly Black and brown lives, we were having the same disparities all over in terms of, I could give you an example. Immunization rates for our Black children are lower than the Hispanic and white children. And we didn't expect that because we thought, we were doing the same for everybody, but apparently we're not. So it took, we had to do an internal life to really examine what we were doing. And then after that, we realized, well, we have a problem. And then everybody was in agreement at that time that, okay, well, how are we going to solve it? And I mean, we're taking a multi-pronged approach where we're going to use the strength of the community, and we're going to be guided by the community on how to fix some of these issues. But we're also going to, one of the things we realized is that there's a lot of biases. And there was a lot of things that transpired over the summer in regards to Black Lives Movement. There was some sort of backlash in the community about what was going on. Which was personally painful to deal with at that time, but we also had, as a leader in an organization, I had to kind of put that aside and try to focus on how do we move the whole community towards anti-racism efforts. And luckily we have amazing leadership that was in agreement. And so some of the initiatives that we are putting forward, including recognizing that we are biased in some of the care that we provide and how to address that. So, training everybody on these issues. We are behind in terms of appreciative of the Illinois colleagues already done this training. We are in the beginning phases of planning it. And so, but we see this as, this is going to be a long haul, but we are committed to making it happen.
Thanks, Dr. Pina. That is something for a health system to just identify that as a point of departure from a position, as Mr. Kelly was saying, that there is a position of privilege, and then there's a position of kind of peer interaction, and even those of us who find ourselves in a position of privilege, regardless of race, the question is what we do with that, and what this executive team of doctors and administrators decide to do with it. And again, a source of hope, I hope for some of us. So
yeah, we're excited about that. The other thing I want to comment is that, even though I'm in a position of privilege because I'm in leadership, I'm also a member of that community that's experienced some of these biases. As a child, grew up in a neighborhood dealing with police officers. So I bring all of those experiences with me as well. And so it was challenging at times trying to, because the institution saw me as a go-to person for this, but I was also struggling at the same time. So that's also one of the issues that, that I had to try to deal with, to figure out how to deal with supporting my institution, but also supporting myself personally.
Thank you. One of the things that's just so amazing at being part of the LSA network is that Charlotte and her team did such a great job nationally keeping us informed. And I am told that Sarah Dodson is on the line, the Director of Advocacy for LSA and in Public Policy, and she might have an update for us on the federal, on the executive order. I wonder if we can switch to Sarah, just in terms of keeping this interactive. Sarah, I'm sorry to call you out, but if you are on.
I'm just trying to make sure I'm on video. I don't, maybe that's an okay thing. So
you're on.
Okay, great. And thanks everybody. And I understand there have been some questions, and happy to try to answer those. I'll preface all of it by saying this is a relatively vague executive order, I think is to say the least. It's relatively unclear exactly how it will be enforced or against whom. And I should also say, pending the outcome of the election, it may not be enforced very long, and then just it's something that lives and dies with an administration. But we have some information we can also share after the fact that'll be more in depth. But we understand that this is related to very specific wording related to diversity and inclusion programs. And I'm going to minimize so I can make sure I'm reading the right things here, but basically there's some specific language related to saying specific gender or specific race are inherently biased, that you are, quote unquote, not allowed to say if you are a government contractor or a government grantee. But there's some exceptions to that. If it's a transaction of $10,000 or less, if it's with state or local governments, so if it's not a federal grant, and if you are a religious entity. Now, I think that truly means churches, things like that, not necessarily LSA members, but just to share that point as well. Technically, this is effective now. The Department of Labor has a complaint hotline up and running, but from our understanding, from the understanding across the nonprofit field, in terms of federal grants, there's a 60-day period, which comes up November 21st, that heads of agencies have to report a list of grant programs that could be in violation because they use some of these very specific terms that promote, quote unquote, divisive ideologies. And I should make clear, I'm reading, when I say things, quote unquote, that's because I'm reading it from the EO, and that's not my commentary, but that's what they've shared. And it's also for the grantees, it's things, contracts, for contractors, it's contracts entered after November 21st. For grantees, it's, again, the reporting wouldn't begin from the agencies to their higher ups until after November 21st. So there's some time. And again, while, let's say President Trump loses the election, he'd still be president until January. So there's this like squishy window of whether or not this would truly be enforced. So it's definitely concerning, and there's certainly some specific that's included here that's important to note, but it's also, it may be time delimited.
Sarah, thank you very much. And I know a number of us have had a question about that. So really appreciate that. And we can turn to LSA for further on that upcoming. But again, that's the executive order that we think began within the federal departments themselves and has increased in scope to federal grantees and certain programs. There's always, as you know, a funding threshold, and apparently it's $10,000 this time, but that can be, of course, increased or decreased.
We're happy to, and to the extent it's helpful, and I'll coordinate with my colleagues here, but we'll share some background materials on that as well as things are shared after this webinar.
Thank you so much for the real-time response
Sure.
from Capitol Hill. Really appreciate that. Caitlin, maybe this is a good moment to go to other questions that might have arisen either thematically or ones that pertain directly to something one of our panelists has said.
Yeah, absolutely. So there was a question from Mary Milliot in the chat box directly to Mike, actually, but there's been this resonates with what some other folks have said. So Mike, Mary was wondering if you could share the organization's name that you've been working with for anti-racism training. And a number of folks have also shared other resources in the chat box. So if you all want to take the opportunity to go through the chat box and see some resources your colleagues are sharing, yeah, they're in there.
Sure, I'd responded in the chat, but it's an organization called Crossroads, which actually has Lutheran roots. Was started years ago by a Lutheran pastor, and has been active for how many decades now, Beverly?
3,
Yeah,
4.
Been in this fight for a while. So they were a good fit for us, and they're Chicago based. So it's what they've helped us, both organization, but we also just slide our leaders into their regular course of what was a 2.5-day training. Now with COVID, it's gone virtual. Would recommend them, but like everybody else, their phone is ringing off the hook.
One of the participants had responded in the chat to that there's also a subsidiary or like a partner organization, ERACCE. I was almost going to call that ERACE, and I'm not sure if they claim that, that kind of acronym, but ERACCE, I believe, is active in a different state, but is affiliated to Crossroads. If I've just butchered that, whoever made that comment, please, okay, Trish Burns is saying yes, they do. So their state affiliates or partners. I appreciate that. And Mike and Beverly, thanks for bringing that up for us as well. So wonder if we could, Dr. Pino had mentioned, of course, in their context, the connection between systemic racism and the racial justice work that so many of our organizations want to do, and our, oh, by the way, public health crisis that is determining so much of our lives now with the pandemic. I wonder if Damon, Beverly, Mike, if you wanted to comment on, in this broader context, how are you steering racial justice work or becoming an anti-racist organization in this context? And maybe even as specifically as, what does racial justice have to do with the pandemic or adapting? Let's say 2021, 3-5 years, adapting to a new normal.
So I'll go first. I think, as I think about anti-racist work, people really need to understand that it's an ongoing process. It's a long process, that you're not going to go from one way to totally anti-racist in the span of a month, in the span of a year even. It's ongoing work. And I think part of there's a lack of understanding, I think, on what anti-racist work means. And in my mind, all it means is that we're looking at our institutional structure and making sure that people of color in particular, but all people, have an equal voice in participation and in understanding. And so as long as an organization commits itself to dismantling the effects of racism, as long as an organization commits itself to being an inclusive organization for people of color, and that means, looking at, for example, your job descriptions. Does the job really require a master's degree? Does the job really require a driver's license? Sometimes we put these hidden barriers in front of us that prevent the employment of people of color, not understanding that that's the impact that it does. In my mind, can you be a successful case manager without a master's degree? Absolutely. I'd rather have somebody with 20 years of life experience, quite frankly, than somebody who just been out of school 2 years with a master's degree and is talking more theory than practice. So I think that's one of the ways we look at issues of racial justice. I think also, as we work with communities, we really need to be open to their voices, hearing what their concerns are. We, as the privileged professionals, always think that we have the answers, and the answers really oftentimes come from the people that we're serving. What are their needs? What are their concerns? Evidence-based practice is great, but what works, and no disrespect to anybody in Iowa, but what works in Iowa may not be functional in the South Bronx in New York City. And so I think we need to be cognizant of that.
Yeah, great words. And I appreciate you getting a little more specific with us too, both about hiring practices, job descriptions. I heard of some of that, and the locality. I think a group like a network like LSA, I think, is really aware of the fact that we roll up to something nationally with all this Lutheran infrastructure, but we are ultimately, like whoever said all politics is local, we are ultimately local in that way, and a product of and help to change those communities that are different, very different. Appreciate that. And Beverly, Mike,
Yeah.
how about in either Cook County or Illinois or in your area there?
I'm always taken. I was taken back by when COVID-19 hit. People were surprised by the disparities that got revealed. It's like, why were you surprised by that? Why didn't we anticipate that? Why the surprise? Oh my goodness. And I think as we've done our work, you naturally go, you have to involve the other systems that our children and families with whom they interact. So that means the health system. That means the juvenile or adult juvenile justice. It means schools. It means courts. It's this issue of systemic racism permeates our society as a whole. And without stepping back and really beginning to peel the onion, what you do good is also limiting. So I think while you are focused, you also have to think big, broader, and it involves many more systems and people than in your organization, within your organization. And the more you get the involvement of the others, I think the better this issue of systemic racism gets addressed. And but we all have to, and it's hard conversations. It can be uncomfortable, difficult. In Crossroads training, they talk about having courageous conversations with one another. You have to be willing to stay in that space with people and saying, and trying to listen and join with, as opposed to opposing and saying, there is no such thing as systemic racism. And it's hard. There's nothing easy about it, particularly because you have to figure out how to sustain over many, 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 many years to come. You know, we're talking about 400 years of systemic racism. In 6 months, 2 years, or 3 years, we're not going to eliminate it. So I think it's the perseverance and leadership, not just because of your position, because we have leaders in our organization who hold a variety of positions, but they are influencers around this issue. But I think you just have to, I shouldn't use the word just, you have to be willing to stay in for the long haul in a very different way than we are accustomed. You're just not going to go to a training. You're not just going to read a book. You're not going to just go hear a speaker and we can say, well, we address the issue. It really means looking within yourself, but also your own system, but all the other systems our children and families come in contact with, and getting them hopefully to join you on this journey.
I'm gonna add really quick to that, because I think COVID brought it out, but I think it's real important for the LSA network being represented by denominations that are the least diverse, at least the last study I saw in the United States, that you know, it frequently, and we've had a lot of energy of messaging. This is the ending racism, ending the disparity that is felt by people of color is not the job of our Black and brown colleagues take on and to shoulder that burden. It's all of ours, and particularly those that have whether knowingly or not benefited. So being a white male, having benefited from a society that was structured in a way to put no obstacles in my way and to put many in others, I think it's real important that again, as a network, we accept that this is all of our responsibility to address and right this wrong.
Yeah. Can I just add, Mike, what you just said? I just really want to reiterate that all of this work, anti-racism work and things that we're doing, it does not mean anti-white. And I think people really, really need to recognize that it's like, it's all of us together, coming together to solve an issue that's killing people, literally. And that's also, making your organization less productive, less successful, because not every voice is heard. So, you know, that's one of the messages I try to get across here, is that this is not about anti-white. This is about us, all of us.
Thank you. And another question from the participants. Elise Berry asks if you all could get a little more specific and maybe talk about anti-racism work with your board. Damon noted that earlier too, some of the disparity there. So the board composition itself, and also the kind of board as leader in these processes and journeys. Anyone want to take a shot at that?
I mean, our board, I will say we've offered board members the opportunity to participate in the Crossroads training, and several have. And I'll let Mike talk more about that. The board is predominantly white men.
So, yeah,
and I think that while they appreciate the issue, I'm not sure how much they grasp all that's involved in all of that.
So yeah, to echo Beverly, we've had several attend the Crossroads, and then again, as COVID hit, because it was a 2.5 day in-person experience, we have had our board asked to have a board deeper dive around it. And we have encouraged and may encourage more. We have a certain percentage of our board that needs to be Lutheran. We've brought that down, and unfortunately, I've been very active trying to find and recruit a more diversity for our board, where it tends to be surprise, surprise. White people have for the most part congregate with white people. So when they're thinking of somebody that they know that would be good on the board, they're usually promoting up. So it's trying to break through some of that and kind of get them to a place. But again, we've started. Some have attended the Crossroads. They've asked for a more deeper dive, I'm in the we've kind of delayed that a little bit, thinking it would be better in person, but I think we're going to have to structure something that can be virtual.
Mike, before we leave you, Therese Thompson has a quick follow-up about, you mentioned FLAC earlier within the organization. She's wondering if you just want to locate that FLAC, or maybe not name. Oh,
sure. Where hasn't it been? First of all, this is about, you're being anti-white, along with our, anti-racism. We also looked at inclusion and looked at how we could embrace the LGBTQ+ community. So we had staff say, well, if you're not Black, brown, or gay, you're not going to get promoted in this agency. We've had the board push on, as I think it was Paolo who said that we're not. This isn't saying we're anti-white, where that's the first thing a lot of people hear. As a matter of fact, when you start these dialogues, it's amazing how quickly the room tries to turn it to something else. About sexism, about homophobism, about which are all significant issues, but we had to constantly say, great, but today we are going to specifically talk about racism, and so lots and lots and lots of pushback, I guess. Maybe I use the term flack, which sounds like something I would say, but significant pushback, and it's really, and even when we were talking about the current administrative order, I'm sure my three colleagues on this panel know that there's risk when you take on racism. And so I challenge us to not back down from that risk. And I get it. I got a budget I have to hit too, so don't get me wrong, and payroll to make. But this is not risk-free, as we've seen, and that's not a surprise, I would assume, to anybody of color. Anytime you confront that, it's probably a bigger surprise to folks like myself who could use a tanning bed.
Thanks, Mike.
And
I don't know
I
if you
think
want that
it's-
to be a last word, but let me go to, we have a couple of minutes. Appreciate that. A couple of minutes. Let's maybe go to Damon and then Beverly and Paolo. What is the last word that you would give to our colleagues here about maybe the cost, and then some specifics, just a specific resource or something that you found really helpful? We discussed Crossroads, for example. Last words of where you are and maybe some resources for our colleagues.
Sure. So I'll start. So they're called courageous conversations for a reason. So don't be afraid to engage in those conversations. If it's something you're truly committed to, then you stick with it, just like anything else. And as Mike said, there will be flack, but if your aim is true and your goal is strong, then you'll be able to overcome any quote unquote flack that you face. The other thing that we've done as an organization is we started a social justice book club. And the book that we read, which I would highly recommend, is Deep Denial by Reverend David Billings, which sort of gives an overview of white supremacy in the United States. And it helps people to understand where these conversations come from, where the place that we're at today, where that comes from. It's rooted in the founding of the United States. It's rooted in our history, and that, you know, as Dr. Pina said, you know, anti-racism does not mean anti-white, but there really needs to be a recognition that there have been privileges that have been afforded in this country that everyone has not had the pleasure of benefiting from. And that's, you know, that's a hard conversation. I know just amongst my board, we're in the middle of a strategic plan, and we spent a lot of time trying to decide whether to use the word inequity versus injustice. In my mind, injustice is a result of inequity. And so it's, you know, we could wordsmith all we want, but we have to have the conversations, and webinars like this and meetings like this are part of the first step.
I appreciate that. And you've been a very forceful presence, Damon, in this and a number of other, our colleagues know, in a number of other non-Lutheran settings too, and online. Appreciate that. Beverly and Paolo, any last words and specific resource?
I would just say, you just have to start. There's no roadmap. There's no like plan you created within your own organization. And you start with a core group of people and it's like the ripple effect. But by doing nothing, we will just continue to have the inequity we have. So either we're fine with that or we want to change that. And changing requires work, focus, and as a person of color, I've had to do a lot of talks within myself because there are things that have happened to me over the course of my career that I haven't thought about in a long, long time that have been brought up recently. But within our agency, we have a core group. It's called the Inclusion Council, made up of staff of all levels around the state who meet and guide and keep us accountable for what we say we were going to do. But just start, just jump in. You'll be okay. You will not drown. You will be okay. But doing nothing says we're satisfied with the status quo.
Yeah, Beverly, I agree. You have to start somewhere. And I always see this as sort of like, I'm talking about addiction medicine, that It's a cycle. You will make mistakes along the way, and it's okay. Just get right back on the bus towards the anti-racism work. I'm going to share a link on chat. It's I've been going around to all the different departments and trainees and talking to them about how to get to the next step about anti-racism. So these are just sort of like it's questions that you want to ask yourself on a personal level and how to get to the next level. So I'm just going to share that. Feel free to use it. It's on a public site. But yeah, that's it. And thanks for listening.
Thank you so much to all of us, to all of you for listening in, participating. Thank you, Damon. Thank you, Paolo. Thank you, Beverly. Thank you, Mike. I use your first names here, although I know in communities of color sometimes I'm using that as a sign of, first name as a sign of familiarity and respect. And I hope you all have heard both some resonance, maybe with your particular locations and stories as you work across the country, and maybe even some very specific ideas, some resources. There's been a very active chat thread on resources, so thanks. I mean, that's awesome. I know the LSA team was hoping for that as well, in an interactive forum. So I can tell you, Beverly, that you inspired us at LMM around some of what you'd said about naming what's important. Is this important? And doing it and starting. And I heard that echoed, of course, with our other panelists around there might be some backward steps here, but one step forward, 2 steps back. I would convert that into saying 1 step backward, a couple steps forward. And I think that as we always have, in our country's long and troubled history, Lutheran services, Lutheran ministries, the network has been #1 inclusive of non-Lutherans, and we are richer for it. And #2 has shown up publicly in troubled times. And I think of Dr. Bob Gretz, who is a Lutheran pastor, who was an early civil rights activist, who we lost last month at the age of 90 something. Knew Dr. King, et cetera. And maybe they're quiet ways, maybe they're in your organized and visible ways, but I thank you also for such great collegiality and networking. And I would hand it back with that to Charlotte and her team. And I thank you all for a really rich discussion.
Thank you so much, Drew, and all of the panelists for courageous conversations and courageous sharing. And your willingness to share real life experiences. It's definitely enriched us all, so thank you. And as many of you have said, this is really the beginning, this is not the ending. You know, we've also formed here at Lutheran Services in America a race equity group this summer, and a number of the panelists here are part of that. We would welcome you to be part of that as well. And if you're interested, please contact Caitlin, who will be putting her email information into the chat box as we speak. And feel free to save the information in the chat box as well. There's a number of different resources there, and we can also share those with you as well. But thank you to all the panelists. Thank you to everybody who participated today. A critically important conversation, and to your point, Bev and Damon, it doesn't end. This is ongoing. So thank you, everybody.
Thank you.
Thank you. God bless.
Thank you. Thank you.